From the start of the pandemic, NHS staff have been risking their lives to help us get through. Tributes have been paid throughout, but clapping only goes so far. On the front line, the proposed 1% pay rise for health workers has not been well received. Melissa is a nurse in Birmingham. She has looked after COVID patients since the start of the pandemic and says the news is demoralising.
It's awful because we're not even out of what we've been fighting for, and we've already been told, no, it's not going to happen. It's very easy to stand there and clap on a Thursday night, but that's not doing anything apart from picking us up at the time. And we still need picking up now. We're still going to need picking up for the future.
NHS Providers, the body that represents employers in the health service, has also criticised the proposal, saying the government's long-term funding plan for the NHS had assumed a pay increase of 2.1%. There are now warnings that large numbers of nurses might leave the profession after the pandemic.
We already had been asking our members about their intentions following COVID, and many were saying at the end of this I probably will throw in the towel, I'll have had enough. And this really just will reinforce their thoughts that for all they've done, it really hasn't been recognised.
The government says it wants to honour NHS staff, but they say the pandemic does, however, have real consequences, and we have done all that we can to protect jobs and save livelihoods. The recommended 1% pay rise for NHS staff is what is affordable, while acknowledging their work and commitment over the last 12 months. The economic impact of the pandemic means other public sector workers are having their pay frozen. But with pressure mounting, many will wonder if the government will ultimately have to change its proposals.